Again, I'm Clarita Santos. I'm with Blue Cross Blue Shield of Illinois. My role in the organization is really around working with communities and addressing access to care and health disparities issue. So one of the programs I wanted to talk about today is Be Covered Illinois. Be Covered Illinois is an outreach and education campaign to educate our communities about the Affordable Care Act. So let me tell you what it is not. So what it is not about Blue Cross Blue Shield products. So when I talk about the program, you'll see it's really about educating the community about the Affordable Care Act. The meeting that Charles had alluded to earlier in his presentation, we actually are one of the recognized partners as part of educating the community about the Affordable Care Act. I know Enroll America was there, Young Invincibles, we were there, Planned Parenthood was there, because really the role is how do we get together and put together our collective assets to really educate the community about the Affordable Care Act. Because quite frankly, this is a really exciting time in our history, and for us to be part of this history and for us to be able to educate the communities, our aunties, our uncles, about what's happening around Affordable Care Act is really a special place for all of us to be in. So what I wanted to do is talk a little bit about the Affordable Care Act. I know Verlon covered a lot, and so did Charles. I'll try not to repeat what's already been covered, but we'll highlight some of the things that have not been covered. Let me see if I can talk in, I think I can, so. Oh yeah, can you? Oh, cool. There's a clicker? Oh, great. Great. So one of the provisions, and I'll just quickly cover it again, because I think it's worth, one of the things that we're talking about, Be Covered Illinois, is considered as another tool in the toolkit, right? Because we understand that in order for a consumer to actually get the message, it takes 7 times, right, for a consumer to get the message. So what we see is Be Covered, like Get Covered Illinois, is again another tool in the toolbox to educate the community about the Affordable Care Act. So some of the key provisions that has occurred today as a result of the law. Number 1, right, the children getting covered and can stay under their parents' plan up until the age 26. What's really key about that is the age, right? It doesn't matter if you're a full-time student, if you have a job, it's about the age. So as long as your child can stay on your plan up until the age of 26. The second thing that's really exciting about the Affordable Care Act is that the preventative services will be covered by your copay. So let me back up and what that means. So when we talk about premiums, right, premiums are the monthly charges that consumers will pay to keep your insurance, right? It's kind of like paying rent, right? We all have rent, we pay monthly to stay in our homes, right? So the premium is basically monthly rent or the monthly amount that you pay in order to keep your insurance. Now the co-payments, what that is, it's a fixed amount that you pay when you go in and see your doctor. So for example, a common copay is $20, right? When you go see your doctor, you pay that $20 for that doctor visits. But under the Affordable Care Act, preventative services, when you go in and see your doctor, so for example, you're going in to see for immunizations, you're getting your physical, you're getting a diabetes screening. Guess how much that's going to cost you in terms of copay? 0. That's right. So that's one of the key provisions of the Affordable Care Act, is that preventative services will be covered. And what does that do? So it encourages us as a community to make sure we see our doctors when we need it and to come in earlier. So I think that's a very key provision of the law. The third piece is there's no limits. So the essential health benefits that Verlon had spoken about. So things that need to be covered, right? Hospital stay, prescription, emergency services, etc. There is no limit on how much that's covered, right? Before, I think a common number that we usually hear, like the $1 million limit. Have you guys heard that before? That's gone, right? Because under the Affordable Care Act, there are no limits in terms of what can be covered under the essential health benefits. Starting in 2014, there's going to be several ways to get coverage. So one of it is through the marketplace, which Verlon and also Charles had talked about. And the other thing that's really key regarding 2014 is pre-existing condition. So what that means is, under the law, it doesn't matter what your health status is, you're guaranteed to get health coverage. So a lot of times, for example, suppose you were diagnosed with diabetes, right, and you're trying to get coverage. In the past, you were denied because you had that pre-existing condition. That's no longer the case. Whether you have diabetes, high blood pressure, whatever that is, you are guaranteed to get coverage. So that's a very key component of the law. Again, essential benefits for all, it's defined on what exactly the types of benefits that are going to be provided to everyone. So guaranteed issue, again, starting in 2014, individuals be assured of getting health coverage regarding their health status. So a lot of times this was the reason why a lot of individuals don't get coverage, is because of this. That's no longer the case. So that's really a key provision of the law. Secondly, there's this thing called the individual mandate. And what that is meant to do is that it requires most Americans to purchase health insurance or pay a penalty at the time of income tax filing. So what does the individual mandate mean? Why do we need to do this? So the individual mandate was there to encourage all Americans to be able to get health insurance, right? So we want to make sure that individuals have health coverage in order for them to access the care when they need it. So one of the ways to encourage folks to do that is, if you do not get health insurance, then there's a penalty. So we know the first year that penalty is, if you don't get coverage, is either 1% for an individual, it's 1% of your income, or $95, whichever is higher. And then each year it will increase. So it's really there to really encourage folks to get health insurance. Subsidies. So what are some, we hear the word subsidies, we hear the word tax credits. That's basically a fancy way of saying you can get help to pay for your health insurance, right? And so I think the key message here regarding subsidies is there's certain income levels that are defined, right? So basically, the lower you make, right, the more help you get. The more you make, the less help you get. I think that's a key component of the subsidies. You will get help in terms of payment. Now, there's a couple different ways you can help, with Verlon talk about. We can get into that a little bit later. Oh, it's right here. See, I don't have my slides that well. So there's two ways. Remember earlier I talked about the premium, right, which is the monthly payment that you pay to keep your insurance. So one of the ways you can get help is through helping to pay for that premium, right? The second way is, if you are at 250% of poverty level or lower, not only can you get help for your premium, but you can also get help to pay for your cost sharing or your co-payments or your deductible. So it's really, the Affordable Care Act is really designed to increase access, affordability, and availability to the uninsured. Other benefits for children and young adults. Children with pre-existing conditions, again, can no longer be denied. Adult children, again, can stay on their parents up until the age of 26. Women, do we have women in here? Yes, we have women. There are also new benefits for women. Health plans will cover certain medical services. One of the now medical maternity care must be covered. In the past, some health insurance plans did not cover maternity care, but again, this is part of those essential health benefits. Maternity care will be covered. And if you go in for immunizations, osteoporosis screening, mammograms, pap smears, and birth controls, those are considered prevention. So how much will you pay when you go into the doctor if you get that? Zero. That's right, because it's preventative services. So the online health insurance exchange, which Charles and the state is really responsible for, is going to be opening on October 1st. So what I thought I'd do is just a quick overview of what that will be. And I know Verlon did that too, so just quickly, it's an online system for individuals to sign up for insurance. What it'll do is, it'll tell you basically, you enter in information, it'll tell you what you can get, right? It'll tell you what kind of insurance you can get. So let me go through the next slide and talk about what does that mean. So individual and small groups plans are going to be categorized by 4 coverage levels, right? I know they call it metallic levels, but I think of it, it's kind of like the Olympics, right? There's bronze, silver, gold, but never another one called platinum, right? But regardless of what level you choose, those essential health benefits will be covered, right? What's gonna be different is, depending on what level you choose, the more expenses will be paid. So for example, if you choose the bronze level, what that is, it's the lowest premium, right? Lowest monthly cost, but the plan covers 60% of your medical services. So that means an individual will have to pay 40%, right? Let's go to the other end, right, which is the platinum. And this one has the highest premium or the highest monthly cost, but the plan covers 90%. So the 10% that's not covered would be the responsibility of the individual, okay? So those are the difference in terms of bronze, silver, gold, and platinum. I want to pause here. I know there were several slides I already went through. Are there any questions so far regarding what's been presented? Or do you want to hold the questions, Malik, until later? Okay. Okay, great. So this was already covered in terms of Medicaid expansion. We have it in our state, tax credits, and also cost sharing. We talked about subsidy eligibility. You know, I do want to share a lot of the questions that we get in terms of subsidy eligibility. Through Be Covered Illinois, we do have a call center. We launched Be Covered Illinois in April of this year, and we do have a call center, so individuals can call and ask any question about the Affordable Care Act. There's no such thing as a bad question. And so far we've gotten about 6,000 calls, and about 2,000 of those calls have been in Spanish, because we have the ability to provide information in English and in Spanish. One of the common questions that we get is, if you are undocumented, right, what can I do, right? And so what we've shared is that individuals who are undocumented can still purchase insurance, but they won't be eligible for the subsidies, right? So, and the way that works is, you've heard of exchange and marketplace. That's usually the same thing, right? It's the online system. There's another thing called whatever's offered on the exchange, off the exchange. So for example, if someone went directly to an insurance company, right, and wanted to buy an insurance plan, the prices that are on the exchange have to be the same as wherever they go anyplace else, right? So if you're undocumented, you can purchase insurance, you just won't be eligible for the subsidies. Now, if you are a legal resident, so that means you have a green card and a visa, you are eligible for those subsidies. Okay.
Off the marketplace.
Off the marketplace.
They would be able to purchase insurance off the marketplace.
Right.
They're undocumented.
That's right, off the marketplace, which means it's not on the exchange, but go directly to the health plans. Okay. The other thing, so we kind of covered that. Okay. Again, if you don't have insurance, October 1st, right? October 1st through March 31st is when you can sign up. But the date that we're kind of pushing to is December 15th, because if you want coverage starting January 1st, 2014, you have to enroll this year by December 15th, right? But so that's a key date to remember. Again, beginning October 2013, the exchange will be up, or the marketplace will be up with the Get Covered Illinois. So individuals will be able to go to Get Covered Illinois and sign up for health insurance. And at that site, you'll be able to get your questions answered regarding coverage. So what can you do now? Right now, so Be Covered Illinois is our current education initiative, and we currently have materials for the community. So what that means is we have materials in English and Spanish. I think you all have folders at your desk. We have information that we can provide to you if you decide to be a partner. The Illinois African American Coalition for Prevention is a partner for Be Covered Illinois, and to be a partner for Be Covered Illinois means you get access to this information. So what does that mean? So that means somebody can come out and do a presentation for your organization or any of these materials. One of the popular ones that we get is there's one around the glossary of terms that's like really popular. You know, what's a premium, what's a copay, this is like alphabet soup, right? There's a lot of words to define. The other one that's popular is about you may be eligible to get help. So it kind of breaks down that scenario. So again, we're happy to offer that information to anyone in this presentation today at no charge. The other thing that we have access to is we do have a texting campaign for if you'd like to get information about healthcare reform. The other thing that we find helpful is a lot of caseworkers or case managers find the 1-800 number very helpful, because as their clients are coming in and they're asking them, can you please explain to me what a subsidy is? They call this number because, quite frankly, we're all learning together, right? So you can sit down with their client, call this number, and together we can learn about, how can we learn more about the Affordable Care Act. So this number, 1-888-809-2797, is solely dedicated around the Affordable Care Act. If you want to learn about products, sorry, they're not gonna answer it. They're gonna shoot you over to another line, because this line is solely dedicated again to the Affordable Care Act. The other thing I wanted to call your attention to, on October 6th, we are hosting a care fair. Again, we're working collaboratively with the state. They will be providing in-person counselors during that site. So it's a care fair. We're gonna have, face painting. We're gonna have, groceries. We're gonna have. It's gonna be a fun environment from 11 to 5, and it's really the opportunity for individuals to find out about the Affordable Care Act. It's going to be at 3900 South Ashland. We're looking to see about between 3,000 people is what we're looking to encourage. So we've been working with the ministers, we've worked with community-based organizations to really get the word out, because this is really an opportunity. In my mind, this is a social justice issues, and any way we can educate our communities on what they have the right to have, we should do it. So that's the end of my comments, and I'll be around. If you have any questions, I'm happy to answer them.
I want to send regrets from Commissioner Shakir for not being here. He's actually at City Hall right now in a meeting about the ACA, and also working on a very other important initiatives that I'll tell you about in just a minute. But he really did want to be here and sends his regrets. I also have to send my regrets, my personal apology to Laura. I have been given strict instructions to be back at City Hall by 12 noon. So I'm out of here as soon as I finish this talk, and I do apologize. But if anybody has questions for me, I will take your questions by email or phone, and will also share my slides if you want them. The City of Chicago, in Mayor Emanuel's first 100 days in office, released the Healthy Chicago Agenda, which has 12 health priorities that we focus almost exclusively all of our work on. And access to care is one of those 12 health priorities. So the Affordable Care Act has been a key issue for us all year long. I'm going to go off on a tangent, and Malika's probably going to want to take a cane and pull me off the stage and say, you're supposed to be talking about access to care. But I'm also going to talk a little bit about tobacco and breast cancer today, and specifically cancer disparities, but I promise you, Malik, I'm going to tie it back into the Affordable Care Act. So let's talk about the tobacco real quick, and then we'll come back and talk about the Affordable Care Act. The reason why the Commissioner is in City Hall today, not only talking about the ACA, is I gave to everybody when I came in a copy of Commissioner Shakir's comment that was submitted to the FDA today about menthol-flavored cigarettes. And in that letter, there are several provisions that are highlighted that talks about the incredible disparities that exist within the Black community because of menthol-flavored cigarettes. The truth is these products are aggressively targeted to minority communities and the Black community in particular. By the way, this ad that you see here with Cool, those kind of ads don't exist in traditional white magazines, right? It's a product that is really aggressively targeted towards the gay community and other minority communities. And research shows that to be true. In fact, there was a recent study that showed that around schools where Black children attend, prices for menthol-flavored cigarettes are lower. And not only that, but promotions are substantially higher. And this study that we cite up here on the screen showed that around schools where African American children attend, promotions for Newport are up to 42% higher. This community is being aggressively targeted. And research shows that it works. According to the federal government, 82.6% of black people that smoke menthols, and only 23% of white people that smoke menthols. The campaigns have worked. The FDA has been studying this issue for quite some time, and their advisory board came out with a report that said that it is likely that menthol cigarettes are more addictive than regular cigarettes, and they're harder to quit. And rather than do something immediately about that, they studied some more, and the FDA officially released on July 23rd a report that talks about the fact that there is substantial evidence that shows that these products are indeed a public health danger, that they increase smoking initiation, especially among minority children. They're more addictive and they're harder to quit. And research has also shown that we can see significant racial and gender and socioeconomic disparities related to menthol-flavored cigarettes, including health disparities and health outcomes. So actually, I'm so proud of this coalition, by the way. They joined with the city and several other partners in September to hold town hall meetings to talk about this issue and how we might engage in local policy making to curb the use of menthol-flavored cigarettes, especially among minority children. And we got an amazing response from a number of groups that represent minority communities saying, thank you for doing this. But one question, oh, and by the way, this is what the commissioner is doing today. He's actually, you see the letter on your desk, submitting commentary to the FDA saying, we can't do this alone at the local level. The feds need to do something to take care of this as well. But regulation alone can't solve this problem. Bring this back to what does this have to do with the Affordable Care Act? The question is, why is the black community being targeted? And in your letter, I've highlighted, I think it's the third paragraph, the truth is that the industry targets the gay community and the black community because those folks are the least likely to have coverage. Those folks are least likely to see a doctor. They are, even let's say that they do have coverage, they might not have the quality coverage that non-minority communities have. They're less likely to get an intervention, less likely to have access to things like nicotine replacement treatments and behavioral-based counseling. So what we know is that disenfranchised communities, communities like the gay community and the black community, when people pay attention to them putting together these amazing ad campaigns, which apparently I can't get back to, but you saw the guy in that cool ad. I guarantee everybody in this room either wants to date that guy or be that guy, right? And we respond to those messages because we've been disenfranchised for so long, and we see somebody paying attention to us, and we become very brand loyal customers. But that's not the kind of attention we want. There's another reason why we are, why we are targeted by the industry, and that is we have less access to care. So we're brand loyal consumers, and we're more likely to be lifelong addicts, and one of the biggest reasons is access to care. So I would like to say to people that we need to listen to what Nancy Pelosi said the other day about the Affordable Care Act. She's a big champion of the Affordable Care Act and rarely criticizes the Obama administration. But the other day she came out and said that the messaging around the Affordable Care Act was lacking. That we didn't have the right messages, we didn't have the kind of messages that resonate with the community. And you know what? I think she's right. We need to be talking about the fact that the African American community is targeted by the tobacco industry because they don't have access to care. This is a social justice issue, and we should treat it like a social justice issue. So let's talk about breast cancer real quick. I'm sure most of the folks in this room know Dr. Whitman and the studies that he's done around studying health disparities, and specifically health disparities in Chicago. And they're huge. They're massive. And in fact, Dr. Whitman's studies have said that Chicago's health disparities remain very bleak. They're not getting better. And they're so bad, the gap is so bad, that it's estimated that 3,200 Chicagoans a year die because of the health disparities gap that exists. And overall, that means 1/3 of all deaths in the black community are what we call excess deaths. If health disparities did not exist, 1/3 of the people in the African American community would not have died. That is an access to care issue. And I can tell you around breast cancer, that's an access to care issue because women largely are not getting mammograms in the black community. And the number one reason why they're not getting mammograms is an access to care issue. So maybe this is what caused Fannie Lou Hamer say, I'm sick and tired of being sick and tired. Are you sick and tired? Again, what does this have to do with the Affordable Care Act? It's because so much is at stake with the Affordable Care Act. This is not just about exchanges and bronze, silver, platinum plans. This goes to the heart of health disparities and social justice. What's fascinating to me is in 1906, W.E. Du Bois wrote a document that studied the health, disease, and mortality of the African American community. And in 1906, he said that disparities that exist were because of lack of access to health care. 1906, and now we're in 2013. It's over 100 years later. Too much is at stake to not get folks enrolled. So October 1 is that day that we've been hearing about where the exchanges go live. And I also want to reiterate what Clarita said, which is another key date is December 15. December 15 is our deadline to try to get everybody enrolled so that everyone is covered by January 1st. I'm going to fly over these slides because I think that other folks talked about them, but what you need to know is there's a lot of community-based enrollment support that's going to be starting with navigators, in-person assisters. If you want my slides, I'll send them to you. They explain what the difference between navigators and assisters are. The truth is, we don't really care whether they're navigators or assisters. They are trained people out there to help. So let's talk about the Chicago Department of Public Health's role in the Affordable Care Act. We have been engaging in quite a bit of advocacy to make sure that the ACA gets implemented. We were very aggressive in Springfield with Medicaid expansion. We have just announced a new initiative with Chicago Public Schools. Right now there's about 50,000 students in Chicago Public Schools that are eligible for Medicaid that are not enrolled. So we've released an RFP to have a community-based organization lead the efforts to get those students enrolled, and then we'll leverage that initiative to also try to get the rest of the family enrolled through the Affordable Care Act. We've been working a lot with the governor's office and also with Illinois Health Matters. And in fact, with Illinois Health Matters, we released this report. It's available online. We're calling our efforts at the City of Chicago Enroll Chicago. And we released an Enroll Chicago report. And this report shows where and who is eligible, where the people are that are eligible for coverage and who's eligible. And what's fascinating, this map kind of, you can see, no surprise there. I think this is like every map we always do in Chicago where disparities are, and no surprises, it's the same neighborhoods. I don't care if you're talking about obesity or smoking or who has coverage or doesn't have coverage, the map always looks the same, right? But we really break it down into detail in the neighborhood level and show where these people exist and also who's eligible for coverage. 75% of folks in Chicago that are eligible for coverage through the exchanges are either Latino or African Americans. That's important. And we need to go and find folks in their neighborhoods and get them enrolled. We're doing a lot of information sharing and trying to identify and address access to barriers. Again, flying through this really fast. This is more information, which I realize that's really kind of small, but more information about where the children are that are currently unenrolled, that are eligible for Medicaid, and our effort to get those kids enrolled, and the RFP that's currently out on that. The City of Chicago believes so strongly about the importance of enrolling folks in health care coverage, a health insurance plan, that we are taking an all-hands-on-deck approach. Literally, every department in the city is doing something. The library will have information for people to visit the libraries, right? It's not just the health department. Family Support Services has a huge network that deals with, for example, the homeless population, which is one of the hardest populations to reach. We will be aggressively going after them and making sure that some of the most at-risk folks get covered. The city colleges, the mayor's office for people with disabilities, they're all doing something. Business Affairs and Consumer Protection is doing something. Even the aviation department, the airports, will be launching initiatives targeted at traveling businessmen and other folks that live in Chicago to get folks enrolled. It is an all-hands-on-deck approach. And what I say to you, what is your all-hands-on-deck approach? Are you going to be taking this information out to your community groups and organizations? Are you pushing this information out for your churches? Because we need you to. Kathleen Sebelius, I shouldn't call her Kathy.
Please don't. She wouldn't like that.
No, she wouldn't. No, you can tell her. That's right. Sorry, a little informal. The secretary was here in Chicago on Valentine's Day and talked a lot about the Affordable Care Act and also how it, relates to Healthy Chicago. And she talked about, having access to care alone is not enough. That people need to know where they're going and they need to be able to be educated about how the system works. The truth is, I'm going to skip really quick to one of the things that we need to remain very vigilant about is educating the public about how they use the health care that they've enrolled in, especially for the folks that have never had health care before, right? There are a ton of people that are going to be covered for the first time that have never heard of urgent care. There are a lot of people that are going to be covered for the first time who have used the emergency rooms as their primary source for health care. And what happens is, if folks are not educated about how to properly use the healthcare system, they won't use it properly. So somebody that's covered for the first time gets a headache, and they go to the emergency room. And if the emergency room isn't prepared to send them in the right direction, they might get a CAT scan. And do you know what a CAT scan is going to do? Nothing. It's going to suggest they have a clean bill of health. We did nothing to diagnose their issue. And by the way, poor Clarita, Blue Cross Blue Shield, just paid for the most expensive preventive treatment you could have ever imagined, and there wasn't even a proper diagnosis. There needs to be ongoing education, even after enrollment, about the proper way to use health care. Women need to know that mammograms are covered, and it's not going to cost them a dime. These are all things that we need to be doing in our community. These are things that the city of Chicago is doing, and I encourage you to join us. So I've put up there our Twitter, our Facebook, our phone number. My email's very easy. It's my first name, Kendall, last name, stag@cityofchicago.org. My name is on your program. If you want these slides, if you want more information about what we're doing or how you can get involved, please, by all means, send us a note. Thanks for having me.
Our next presenter is Laura Leone, and Laura's with the Campaign for Better Healthcare. And for those of you that have been paying attention to what's going on in D.C., there's still some work to be done on the advocacy level to ensure that all of the benefits that are going to enhance healthcare for us are in fact delivered. So Laura Leone is going to come speak about some of that. Please join me in welcoming Laura. Thank you.
Thank you. Thank you, Malik. And I really want to thank you, the coalition, for all the work that you've been doing to make this possible. So, in fact, what I would like you to do is, because this is really a historical time. It's many presidents have tried to make this change and try to make a comprehensive healthcare program, and it wasn't able to, until and I'll show you this picture just to remind you, until March 23rd of 2010, when the president signed the Affordable Care Act into law. And so I would like right now, if you don't mind, give your partner sitting next to you a high five, because it's something as a country we are making a change. Yes, this is exciting. I know I'm thrilled, that I know that after, October 1st, beginning October 1st, that I'm going to be able to help people to enroll into healthcare coverage. People that are working, sometimes working 2 jobs, trying to make ends meet and haven't been able to afford health care. We are going to make a difference. As this country, and as also was mentioned earlier with Kendall, there's things that we're going to have to inform our communities and sort of train them. I know that I come from a culture that we're so used to using herbs and teas, we try to wear them out until we have to go to the emergency room. But now there's healthcare, that preventive healthcare that in the past wasn't there. And so this is where we need all of us to be ready to get that information out. But I also need to tell you there's still some challenges regarding the law of the land, which is the Affordable Care Act. And so, doing this right. Okay. So on a federal level, and thank you, Malik, as many of you have heard, that the House had passed a measure that would defund the Obamacare. And our U.S. Senator Clerk had actually said yesterday that he stands, and I'll read his quote, "I stand with the majority of Americans in opposing Obamacare, which is why I have voted against it 36 times. I support the House-passed measure that defunds Obamacare without increasing federal spending by a dime while preventing a government shutdown." You know, we got the law passed, and they continue to go after it and create confusion and also waste our dollars and try to cut the program. We need to be strong advocates to make sure that we protect what we already have won, and that we are going to begin doing enrollment October 1st. And I think that's the first message I want to send to you, is that it's important that we make this a success, that we get our families and let them know the information so that they can enroll for health care, because that's going to show why it was so needed, the Affordable Care Act. So legislators, we need to reach out to our legislators on a federal level. I just mentioned Senator Clerk. You may want to give him a call. He said when he was elected, he was going to represent all of Illinois. So if he's talking about the majority of Americans opposing Obamacare, I'm not sure who he's talking about, because I know in my community, and I know in many of the people that I talk to, is they're looking forward. They want to know where is the website. They want to know how they can apply. So, I'm not sure who he's speaking to, but I hope that he hears your voice, and I hope that he hears the voice in your community. So we need you to speak out, and to speak out now. So on the federal level, that's, we got to keep our eye vigilant. When regulations come out, we need to respond. I believe there's one right now regarding the basic health plan. That's an opportunity that we could look at expanding. It's sort of a Medicaid-like program up to 200% of the federal poverty level. That's a possibility that we could bring to Illinois. Additional, more affordable coverage for our members. But those are regulations are being looked at right now under the federal government. On a state level, let me tell you, it hasn't been so easy, and I want to ask Ramon Gardenhire to stand up, because him and Nadine Israel, they led the effort of advocates to make sure that Illinois passed Medicaid, and yes, let's give him applause. Him and Nadine were out there in Springfield every day, and they were always giving us notes and telling us, okay, this legislator's on, this legislator you better contact. And that was very helpful for us who couldn't go down to Springfield every day in order to know who that we needed to reach out to. So Ramon, thank you, and please thank Nadine. And so we do have healthcare advocates. There's a team of them. From the Heartland Alliance, the Shriver Center, Illinois Maternal, who's now got a new name called Ever Thrive Illinois, so look out for that new name. CBHC, AARP, and there's a few others that are able to have advocates down in Springfield to actually talk to the legislators. But most of all, they really want to hear from people within their communities. They want to hear residents from their neighborhood, voters in their neighborhood. So this is where you come into part, that it's very important that we as whatever if you're in social work or you're in healthcare, you're in housing, whatever field you're in, that it's important that you let the legislators know how important this healthcare is. And if you can mobilize your constituencies and your clients, it's important for also them to hear directly about how this healthcare coverage is going to help them. So on a state level, Illinois, right now we have a state-federal partnership, but we need to figure out, are we gonna move to a federal partnership or a state partnership? And that's something over the next year that you'll be hearing. There'll be more meetings and more discussions. We'll have to weigh out, look at the pros and the cons. What works best for us here in Illinois? But this is something that we need as advocates to look and make sure that we make the best decision for us here in Illinois. Right now, I gotta say that the feds and the state partnership has been working tremendously great together. I know that they coordinate calls for all the different partners, and so that's very helpful that the state and the feds are working hand in hand together. So I want to thank you both. But as a state, well, we do need to figure out what will our marketplace look like in the future. So that's a decision that we still have to make. And let me say, I mentioned, Medicaid wasn't easy to pass. Part of the ACA was a high-risk pool. We weren't able to get that through the General Assembly. We actually had to do a bypass in Illinois, where the money didn't go to the state, it went directly to the provider. In this case was Blue Cross Blue Shield. So even though you think that we have a Democrat for our governor and then also for the two chambers, that it's important to reach both sides of the aisle. Don't just think one side. Think you have to let both of them know, the Republican and the Democrats, how important this is and how they need to be strong advocates and fight for more health care coverage. Sorry, I lost my little bit. So I want to remind you all that as non-for-profits, we can do lobbying, and that Congress has deemed it. And actually, these slides that I'll be showing now are from Ramon. But we need to know how we do the advocacy and what can we do. And a lot of things that we do will be more education, informing and educating the legislators. What is in the new law? How many people in your community or their community are going to benefit from the law? You could use the Illinois Health Matters. Have many of you seen that website, Illinois Health Matters? Okay. We'll get that information to Malik for those that don't have it, because you could actually go on there and look in your community and see who is uninsured, and it even breaks down by race, breaks down by gender. I think it even has veterans. And it tells you, do they fall into Medicaid or which program they fall into. It's a very handy tool that the Healthcare Disability Associates have developed, so I hope you would use it. So these are things that we can do as in our daily work, is to make sure that we're doing that education. Now the side where you need to be a little bit more careful is where you're actually talking about a bill number. And in this case, we're not talking about a bill number, we're talking about the law of the land, which is the Affordable Care Act. And I know in my faith tradition, it says that I'm a Christian, and we're supposed to follow the lay of the land. So when people question it, I think that's something that we just have to remind folks. It is the law of the land. Let's take this opportunity. It's historic. There's so many people that will be covered by it. So we're not right now not talking about legislation. So, but that's when you actually start using a bill number. That's when you start crossing the line and moving into lobbying. So there are some restrictions. It's a certain percentage of your budget of how much lobbying non-for-profits can do. You should check with your organization to find out what the policy is. But again, I would really focus on doing the education, the awareness. and sharing the needs within your community. Very key important that we cannot take part in any partisan politics. I think most of us know that, but just want to remind you that's very important. And that's why I say it's important to reach out to both Democrats and to Republicans. Now, how can we show our support? Enroll, enroll, enroll. Let's make this a success so that there's no way they could turn back the clock. You know, that there's no way, and to be honest with you, they can't. They're just trying to cause confusion and reduce the amount of money that we have in the pot. So that's where, but I'd say enroll, enroll, enroll. The second part is sharing stories and testimonies. You know, people who have it don't really think about the people who don't have it. So sharing those working, like I have a niece, she's been working since she's a teenager. She's a young mom now. She has a teenager daughter who just started high school. She works full time, but she doesn't have health insurance. So she called me the other night and she said, Tia, what is this Obamacare? How can I find out about it? So, you know, I said, well, Michelle, can I share your story? And she said, yes, you can. And now she understands why I asked so many questions to her, because it's important that people understand that the need out there. And who are the people who are looking for healthcare? They're in everywhere, every community, every family, every business. You'll find people who need health insurance. So sharing those stories are very important. And Campaign for Better Healthcare, they can help you in documenting those stories. Writing letters to the editor. You see a lot of bad press out there, but there's good press too, but we need to be more proactive in getting information out there. You don't have to write a novel. You could just write a few words and say how important it is. Have some of your clients write letters to the editor. CBHC has a great website you can use, and it has all the listing of the newspapers across the whole state. So please use it. And write your letters saying how important and how historic this legislation is. Meeting with your legislators, registering people to vote and reminding them to vote, those are things that we can do in our roles. And then of course, again, is mobilizing your community. Just as Malik is doing here today with the coalition, but we need to do that in the churches, in the block clubs. We need to get out there and let our people know. The laundromats, in the nail salons, in the barber shops, we need to have these little mini meetings, let them know about the benefits and let them know how that we could also protect them.